Every cancer and every patient is unique, so a personalised approach to cancer care and treatment is key to achieving the best possible outcomes. GenesisCare is developing and delivering innovative, proven and tailored treatments which prioritise patient care from a holistic point of view, delivering lower risks, fewer side effects and quicker, more effective treatments.
So this is a nice case actually because it illustrates the power of that adaptive process to ensure that we change radiation dose according to the anatomy of the day.
At GenesisCare, an advanced type of radiotherapy known as MR-Linac is transforming cancer treatment for patients like Charles.
Charles, very good to see you.
Following surgery for pancreatic cancer, Charles discovered his cancer had spread to a lymph node next to his aorta, the main artery which carries blood away from the heart.
Normal radiotherapy, which has a wide beam and stuff, wouldn't work because you'd get too much collateral damage. So my oncologist referred me to Dr. James Good here at GenesisCare to see whether the Meridian MR-Linac directed radiotherapy system would be able to de-risk any kind of collateral damage. And after doing all the modelling and everything, it was good news we could go ahead with that treatment.
SABRE stands for stereotactic ablative radiotherapy, and it's a radiotherapy technique that allows us to deliver very high doses of radiation really carefully to isolated tumours, and it allows us to use technology to focus the cancer-killing power of radiation to exactly the spot in the body that we need it to go. The MR-Linac is a step change in our ability to deliver SABRE accurately. And so what we were able to do there is safely give that high dose that has controlled that tumour lifelong.
Incredible technology, and in my particular case, it saved my life.
So take me through theranostics. What is it?
So theranostic combines diagnosis and treatment.
In the building next door, clinicians are using a radioactive material which specifically targets cancer cells to treat another group of patients.
It is generally for patients that are affected by prostate cancer and they have not responded very well to conventional treatments such as chemotherapy or hormone therapy. So it's a very targeted and personalized treatment. So the cells that will receive radioactivity, so the cancer, will be attacked and therefore will die. The other cells around it, the normal cells, will not be attacked by radioactivity and therefore will continue to be normal. And that's the difference between having side effect or not.
And embracing the latest technology is helping to provide a more personalised treatment for more and more patients.
We're going to go for the hands task now, okay?
This patient is having a brain scan. Functional MRI is an advanced technique used to create a three-dimensional map of the brain. In red, a brain tumour, and surrounding it, the colour-coded nerve fibre tracts which control vision, movement and speech.
When you show them a picture of their tumour and show them this three-dimensional functional map of the brain showing the relationship of the speech areas, movement areas, vision in relation to the tumour, they get a better understanding of what the risk benefits of surgery are. They get a better understanding of what they are likely to achieve with the operation. They are better informed in terms of consent. You make a shared decision with the patient. And in some ways, you personalize their surgical approach with what the patient wants.
These improvements in treatment, while not new, are not widely available within the UK, but offer the ability to improve both a patient's quality of life and life expectancy.
Hiya, Mark.
Hello.
Do you want to come through with me? We'll do your bloods.
Absolutely.
Mark is receiving treatment for chronic lymphocytic leukemia, a form of blood cancer. And it's in the treatment of blood cancer, technology is once again fueling innovation.
So CAR T-cell therapy is a fascinating new technology. Basically, it takes T cells, and we all have T cells in our body. They're immune system cells. Their normal job is to fight viruses and other microorganisms. Those T cells then get sent off to a pharmaceutical company that genetically engineer them, so that instead of just recognizing microorganisms, they then, in addition, recognize the patient's cancer, and then they go on a search and destroy mission to find the patient's cancer cells and kill them.
Life-threatening conditions are always difficult for patients and often difficult to treat. But using the latest technology and a patient-centred approach is making the difference where it matters.
Ultimately, the thing that we care about is the outcome that the patient gets from their treatment. The way to get the best outcomes is to put the patient at the centre of care, to focus on their quality of life, and to make sure that they have access to all of the available treatments that they need.